Welcome to the Hybrid Therapist podcast with your hosts, Andrew Wild and Andrew Ilieff. We're back, mate. We said we were back last time. That was 2 years ago, and we haven't been back since. But supposedly we're back for good now, once a month. That's the
Once a
plan.
month. That's the plan. Exactly right. It feels foreign again, doesn't it?
It's
Well,
good to
not for
get
you.
back. Yeah, good to get back into it. Obviously, I've been chugging along with my podcast since, but we had every intention 2 years ago to do something like this where we're going once a month, but
Mm.
things got busy. I think as well, we started it just before that Delta wave hit, and then sort of the shit hit the fan and things changed. So we didn't get around to doing it. So apologies for all the listeners.
Yeah, and I think it was funny. It was best when we were doing it face to face, but then you realize how convenient Zoom is, and I don't know why we ever didn't continue it.
Well, yeah, Zoom's great. It is, but it has a few flaws. And I think, as you said, it's, the body language side of things when you're in a room together, it's completely different. But this is a great way to do it, especially in Sydney when we're on other side, either side of the bridge. But I do miss the old Friday afternoons going into the studio in Edgecliff there and having a chat. It was good fun.
A couple of beers with a few of the docs that came in sometimes, and
Well, we haven't we've since COVID hit, we've recorded one episode. So that's nearly 3 years ago. So it's amazing. Time flies, mate.
time's
So
changed, isn't it?
it has. And in the last 6 to 12 months, what's been happening?
Hey, you know what? I think like a lot of practices, we came out of COVID, we were buzzing like as a clinic. We'd never been busier, which was really weird. Um, then things opened up, and I think it sort of went back to level playing field, and it was an adjustment for everyone. But I mean, now I think things here are normal again. We've just worked out our routines. Like I remember, I don't know, I like to analyze clinics, but we used to be pumped on a Monday. Post COVID, we were empty on a Monday and pumped on a Friday.
Yeah.
Now with sport returning, you got to get back in all your physios back in on a Monday because people are actually playing sport. So like working out the routine or the rhythm of the clinics has been hard. And we added a new clinic in Coogee, which has been exciting. So it's just trying to expand the practices and the physios working under us, which is exciting. What about you, mate?
Yeah, I agree with the sporting side of things. It's something I did miss during COVID. Obviously, we don't want people to get injured, but I did miss the acute injuries from
Yeah.
sport that we didn't really have because people weren't playing community sport as much or at all. So really the last 12 months, things have gone back to pretty much normal. People are back playing sport and everything, which is great. But with that, obviously, we have the acute injuries that we have to deal with, which is somewhat exciting for a physio because they are, aren't they? They're a lot more
Yeah.
exciting to deal with than, say, your standard sort of neck pain or something like that.
The sad thing about our profession, right, is that the very essence of it is we rely on people being injured.
Yeah.
I know that's what it is. But the best injuries, again, that sounds morbid, are the sporting ones.
Yeah. Oh,
You
everyone's
know,
different. There's
but
probably
that's
some
true,
people out there
right?
that love the low backs, but I'm with you, mate. Like, give me I don't know, traumatic anterior shoulder dislocation or
Yeah.
an ACL or something like that any day of the week.
Using your skills right as a physio, the assessment that, and I know you're using with a low back, not discounting that, but it's that, someone comes in 24 hours after, mechanism could have been anything because they're in a game of rugby, whatever, game of AFL, you know, none of the testing matches up to anything because there's too much pain. There's hardly any range of
Mm,
motion. But that's the
mm,
fun pathway, right? Is the sports medicine management side of it.
for sure. And
Uh,
I'm getting a fair bit of that now with my role at Riverview. It's kind of expanded from being just the physio and with the AFL
mm.
to now I'm there all year round pretty much. I've got the basketball contract. I'm there on a Monday. So I'm seeing a lot more of those acute sort of summer injuries as well. The cricketers with the low backs, as you
Yeah.
know.
Not stressy. Couple
Yeah,
of
that's
hits
it.
through there.
So it's good to have everyone back playing sport, and then
Uh,
now we're kicking into football season, which means covering the physio side of things at Review for me with the AFL side, but also
Yep.
assistant coaching. So
Nice.
I've got a couple of things going at the moment. So I'm at Review sort of 3 or 2 days a week from now, and then which is good because it gives me a bit of a balance. It's a less clinic work, and then I'm out doing something I like. And the other thing about the Review stuff, which is good, is the hours are really good
Bet.
because they train after school, so it's not like some of the community sport out there where they're training at 7 till 9 p.m. or something like that.
Mm.
So the hours are great, and
Yeah.
then they play either on a Friday night or a Saturday. So no, it's good fun. It's good to get back involved in footy again and coaching. So I was
Let's
once that young pup. So
let's touch on that, right? Is we didn't have much sport last year, even with the rain.
yeah,
Uh,
that
we,
was a
we,
massive issue.
and we lost heaps of rugby, low level rugby. I think with some guys there were maybe 3 or 4 games played in a season. Do you see a potential uptick in non-contact injuries this year with some of those sports? So, for example, ACL, just because kids haven't had that time under the belt with some of the sports, or
Yeah,
you?
potentially. It depends on whether they've done an adequate preseason and what they've
Yeah.
done in the off season, also what they were doing during the season last year. So potentially, we know with the research around the ACL is the ACL gets thicker towards the end of the season
Mm.
comparatively to the start of the season. So it actually does, I suppose, it hypertrophies in a
Yeah.
way, like it, not like a muscle does, but the ACL is thicker at the end of the season typically with a lot of athletes. So maybe we'll soon find out.
Yeah, it's
But
interesting, right?
last year was tough, mate. Like in terms of all of the rain that we had here, and for the listeners, we're both in Sydney, and I think we got more rain last year than any other year in history. Is that right?
I reckon you'd be spot on there because I just
Yeah,
remember game after game, we look after a school and it was like, hey guys, physio's cancelled for the day.
yeah,
All sports off. And that was happening multiple weeks in a row.
yeah.
Uh,
I reckon we trained on a basketball court more
yeah,
than we did on an actual
yeah,
grass field last year because it kept on getting called off the grass fields at Riverview. And then we had so many games moved from either a grass field onto an synthetic field. So
yeah,
Gore Hill Oval synthetic, Blackman's
yeah.
Park synthetic. So there were more games played on those type of surfaces purely because the councils closed the grounds. Like they closed the grounds really quickly up here in Sydney compared to most other places.
Good.
But last year was ridiculous.
Yeah, it was
So
to the bricks.
we're like the other day, I was at footy training on the Wednesday, and we're at fourth field review, and the deck's in great nick, and I'm like, I'm not used to this. Last
Yeah,
year, every time I'd go there, I'd have to wear footy boots because it was just mud. There was mud
yeah,
everywhere. It was
it was
disgusting.
crazy, wasn't it?
Mm,
But oh yeah, that's one of my, you often think like, is this year are we going to see an uptick in certain injuries? I know probably like we had an uptick this summer in skiing injuries. So
people going
people,
overseas.
yeah, go to Europe, hadn't been there in 2, 3 years,
Yeah,
hadn't really skied in Australia. And I reckon in Feb we had 7 or 8 ACLs, which in my opinion is bonkers, right? Like it could have just been the clip's busy, they're all coming in here. But that was a lot of ACLs coming in. And on every single occasion, none of them had skied in 3 years. And they'd
yeah.
gone back to the European mountains and were, you know, letting rip on these on these mountains. And, inevitably what happened. But I mean, interestingly for us, ours were all females,
It was an
which,
increased chance if you're a
yeah,
female, as we know. But
yeah, but like just that's what we had,
mm,
at varying age from 18 through to 40 something. So it's you try and just take a snapshot of the population you're seeing. Is that just the population we're seeing? Maybe, but
yeah,
it was all
I had
female.
a, I had a fair few clients that kind of wanted to do some prehab prior to going overseas,
Yeah,
just to get ready for it because as you said a lot of them haven't skied for years because they only ski overseas. They're not the type of people that go down to Thredbo or Perisher or whatever.
well, we're
And
in similar areas where they don't ski Perisher, they ski Europe,
yeah, 100%.
right? So
And which I completely understand. Like I've skied over in the States, and the runs over there or in Europe are 5 times as long as the ones here in Australia. Like I get it.
yeah,
um but yeah, you're right, they haven't been exposed
yeah,
to skiing for a long period of time, and potentially, if you gradually build them up, maybe it would reduce their chance. But at the same time, you get those ACLs with skiing that are just unlucky. You get
Right. The ski gets stuck and they're done, right?
yeah. So I had a mate last year, he did his, and he which we might discuss next podcast, he did the cross bracing protocol, and he's had a really good result with it, with a healed ACL at this point. Obviously it's going to continue to mature in time in terms of the ACL itself, in terms of the collagen. So we'll see what his result is going forwards, but we may discuss more of that next.
Yeah, I think that'd be a good one
podcast.
next time.
Yeah. While we're on the topic of the ACL side of things, with all those 7 that you did have in, how many of them opted for surgery?
So of the 7 that we had, 3 went off for surgery prior to seeing us almost immediately, like that old school, like injury done, reached overseas, landing in Australia, pretty much onto a surgical bed, and then straight into surgery. Probably one of the young girls that I'm seeing, she's 18 and I'm actually looking after rehab. She's opted for complete conservative pathway, but not using the bracing protocol.
Yep.
This decision was made in lieu with a sports med doctor and a surgeon. That one will be an interesting outcome, right? Like the fibers are retracted on MRI. So let's preempt that one.
We'll wait and see.
Look, and it's one of those ones, right? We're not in a rush for surgery. She's not in a rush. Her uncle's an orthopedic surgeon as well. So like there's a good amount of information coming to this, and he's a knee specialist in Melbourne. So that one, there's a lot of medical professionals around. So far doing really well. And then the other 3, which would put us at our 7 or 8, I think, from there, they've all opted for the delayed surgery. So, they're not rushing into it. But again, they all want to get back into sport. The ones, I must admit, that had it straight away did all have meniscus. There was a tib plateau fracture on one of them. We know the outcomes of those ones straight away. So they were probably in that category no matter what.
Sure.
But it was the age has been varying. Some at one of the late 40s, surgery straight away.
Right.
So, I think some of the processes are still continuing where, surgery or prehab wasn't even considered pre-surgery. I think from our point of view there, it's a mixed bag.
And also we've discussed, and we'll probably discuss more in the next podcast, about the delayed options, often the best option.
100%. So it's not like a pec tear, right, where you need to have them in for surgery straight away. We know that we can delay this with the ACL. So obviously the outcomes dependent on prehab as well as rehab. So the one I am kind of looking forward to this younger one, seeing how that tracks, given she is 18.
The conservative non-operative
100%.
one, without the brace and everything, because we do know that they can heal spontaneously without bracing. Some can.
You know, also you throw in the challenges there of an 18-year-old, drinking, partying.
Yeah.
That
dancing.
100%, and like that already happened in week 2.
Yeah.
So coming back in with a blown up knee. So it's a factor to healing, right?
Well, we have to keep the listeners posted on that one.
Yeah, it could be a good one, might not be. We'll see. I might end up for surgery next week.
Now, the industry, where do you think it's heading? Where do you think it's been in the last 2 to 3 years since we've really gotten stuck into podcasting together? What are your thoughts, mate?
Man, I think it's improved, right?
Why?
I see more people doing active-based therapy,
which we were massive proponents of.
We were not so big on the passive. And don't get it wrong, we both do passive, right? We both do soft tissue. We're not against it.
Yeah.
But we came out of university area where interferential tends like hot packs were all part of the course, right?
Yeah, yeah, yeah.
You know, we,
And you spent a whole bloody semester on EPAs, which is all that
100%.
stuff.
We
I
were
was,
taught how to heat up a hot pack and put it in a
yeah, I know.
fucking like like a what do you call it, paper, like a towel, and put it on someone.
There was a name for it. I forget the name. Hence why, like,
I
we
think
clearly were focused heavily on the hot pack heating when we were in
I
uni.
think I did excel in that though. That might
What
have been
was it?
probably
I forget
HC.
the name of it.
I think you were right. Electrophysical modalities or something like EPA. We had that course.
Yeah, but anyway, there was actually speaking of this is pretty funny. When I was at uni, I did a placement at Randwick at Prince of Wales,
Mm.
and I was there for about 4 weeks. It was like my second musculoskeletal one, I think. And there was a physio there that was working there at the time, and he just didn't want a bar of us students.
Yeah.
And his go-to literally was the client would come in for half an hour or whatever, and he would just put a hot pack on him
Hmm.
for 15, 20 minutes. He would get a hot pack, put it on them. I'm not going to name the name, but put the hot pack on them and just leave them for 15 minutes, go and stuff around on his phone or a computer or whatever, and then come back and then give them a little bit of advice at the end. And then off they went. I was like, what are you doing, mate? Like you could clearly tell that he just didn't give a shit.
He was just burnt out. He was done.
Yeah, he was fully done. He wouldn't be working as a physio now,
No way.
surely.
But I mean, there is still, let's be honest, there's still a lot of that in the industry. I heard a story yesterday of a physio doing stuff like that, and like that's fine. But I think in
But is it?
general,
But is it?
look, that's not how I practice, right? It's not how you practice. It's mediocre,
But someone can do that at home themselves. Like
100%. And we're not going
surely
to,
the point of someone going to a physio is to make sure that they're getting something that they cannot do themselves, or they're getting some education on what they can do themselves at home, blah, blah, blah.
I agree with you. I mean, in terms of the findings, in terms of there are still clinics doing that, but I think overall we are moving much more to an active based
Yeah,
profession.
yeah, I agree.
As general, when we started this podcast, we were ranting about how much we were hearing about IFTs being used.
Yeah, yeah, yeah.
Interferential, like I don't have any in my clinic. I know you don't. I
No,
don't have hot packs in my clinic.
no.
I don't even have, I've got snap off ice packs, and that's largely if someone comes in and we throw one to them and say, like, chuck it on. But
Yeah, yeah.
we don't even have an ice machine.
No, neither.
We would have once in all our clinics had a hot pack machine,
Do
ice
you
machine years ago.
do you have any of the things like I don't know, game ready or something like that?
We don't. We've got compression boots.
Yeah, yeah.
Um, to be honest, they don't get used. Like it's a we when we recommend game ready, we actually go to an external provider to rent them to people at home. So
Sure.
we say like, here's the game ready website. It's out of Marta, the Marta physio up there actually rent
Yeah,
them.
yeah. I
So we
worked there
say,
back
yeah,
2013, 14. Yeah, yeah.
yeah, and that's where we'll say, look, if you want to use this, go up there, rent it from them because we don't provide that service.
Yeah, yeah. It's pretty niche.
It is like, and it's not going to be us.
And
We
also you can probably get the similar effect by not game readying.
look, that's my opinion on it, right?
Yeah,
But
yeah,
a
yeah.
lot of the
There's way,
surgeons,
there's way, there's ways around it and not spend. And you don't need to spend a cent. Do you know what I
no,
mean?
and some of
Also,
the
your body,
surgeons
your
though,
body
they
will do.
request it.
What was that?
Some of the surgeons will request it in their,
Yeah,
handover, and then the patients will come in. So sometimes that's their expectation is game ready. So you'll have at least a pathway, like anything. So look, we don't do it, but if you want to choose that option,
yeah,
here it
yeah,
is. We personally don't. We don't have any of that. We've got force plates from Valve.
yeah.
Um,
Are they
we've got,
good? Are you happy with those? And
oh,
be honest, because Val might be listening here, mate.
look, we don't love them. All right.
Why? Because
Um,
my issue with them, so I don't have any because when I have used them, I think the plates are too small.
we got the large ones.
Oh, did you get the larger ones,
Yeah,
right?
but we
But
find,
still, is it the individual ones for each foot, or is it
yeah,
like a full big?
no.
Because it
So
just should be a whole big square, don't you think?
yeah, I agree with then. Like that would make more sense. But we find
Yeah,
software quite clunky. That's our issue.
yeah, yeah.
So say
That's
for us,
fair.
we're using them, and we're not using them like rotating 5 in a day, right? We're maybe using 5 in a week.
Yeah, yeah,
So in a 45-minute consult, we often find that we have to build it out to an hour to allow 15 minutes of setup
because of the admin side of
because
things.
of it all. So Is there a way to streamline it? Probably, but it's still, it means that it is effort. We do use them, but it has to be we have to plan ahead to use them to make it an effective service. Um, at the end of the day, do people really care about the info we give them?
Yeah, it's another good point.
Not really. Like most people are like, well, I knew that. Like I know I'm stronger in my left than my right. I don't really care about the
Yeah.
percentage. Where we find use of it, and I have to be honest here, when we send a report to the surgeons love that data
Mm.
because it prints it off.
You can, and for the clinics out there that don't have this stuff, because I don't have one, I don't have force plates, and I've considered getting them, and I'm still considering. But there are other ways to do it. All you need is some chalk, a tape measure, do a single leg hop for distance, a triple hop, a triple crossover hop, side hop for 30 seconds across a 40 centimeter line, a broad
Exactly right.
jump. You can do a vertical jump as
Yep.
well and just chalk their fingers or something like that. And then they slap the wall, measure
Yep.
that, and you can do a single leg vertical and a double leg vertical. So there's ways around it
I
without
know.
spending a fortune.
Look, 100%. And we still use
Yeah.
those tests probably more frequently than we would our force plates.
Well, and is
Right.
that because purely from an admin standpoint, they're quick and
100%.
easy? Yeah, yeah. And
100%.
I think I think they're kind of nearly more fun in a way when you're talking centimeters rather than like time or something like that in
And it's
like their
all,
air time or whatever it
these
is.
are gimmicks. Like it's a gimmick, right? Like I'm not downplaying it because they're a great effect, but we find it to be more of a gimmicky sort of thing. And people will come in and they'll use it once. They'll be so excited to use it, then they'll never want to do it again, right? They're just
Yeah,
going
yeah,
through the process. So we don't use it. We've got an electric hand or electric dynamometer, which is actually more effective and it just records strength percentages. I find that more effective for most of what I do if I'm going to do it. Um, but for us, the setup of the force plates is probably our biggest
yeah.
downside.
They take up space as well, you know.
Yeah, yeah, they do. Well, I mean, we're lucky we have them like set up in a certain spot. I mean, you've seen our gym; we've got plenty of racks, so
Yep.
ours are permanently set up and ready to go. So, I think that's probably the only thing that favors us.
Yeah.
Um,
So with the industry, it sounds like you're reasonably happy with where it is trending. Because I think as a whole, and social media's got a lot to it's one of the reasons why this has actually come about. I think that there's been a wave of us and other clinicians and people talking about the active treatment rather than the passive, and it's slowly starting to catch on. But I also think it's catching on purely because the unis are starting to catch on a little bit more.
100%. I
Yeah.
think you're going to see Sydney and New South Wales Uni now doing a joint ex-phys/physio degree, which
Yeah.
we fight. How many years ago did we start this podcast? 5. We said that should have been the pathway for everyone.
Yeah.
That was one of our opinions. We're now seeing that. We're seeing UTS, which does the preference pathway. So from sports science, and if you get a certain ATAR, you then get a guaranteed entrance if you maintain a credit average into the physio masters.
Yeah.
So kids now are having that exercise background. As with when we went through with the post undergrad, we did it because we were interested in it, right? That was our passion.
Yeah.
Which arguably I know could be a better thing because we were actually genuinely interested in it.
Yeah. And you
Um,
had to somewhat think on your feet and do your own self-directed learning,
that's
which
right.
I think helps a lot rather than just getting spoon-fed information. But it sounds like things are heading in the right direction and the unis are finally catching on that
Also,
the exercise rehab is so important.
yeah, and look, I don't know about your clinic, but our clinic, right? We're now 6 years down with two clinics, and we've become a lot bigger in our reach. But people are no longer coming in with the expectation of soft tissue.
Yeah, that's a good point.
So I don't know if that's the industry or if that's our clinics because that's what we're known for. So
I think that's probably both because I
yeah,
think you attract a certain type of clientele based off word of mouth, I think. And these people that are maybe telling their friends to go and see you or me, they probably are telling their friend that they're not going to get a lot of hands-on stuff and manipulation, all this type of stuff that's the passive side of things. So, and even if you read reviews online or something on your Google account, you read reviews for both of us, and they'll probably say similar things like that, where it's like, they'll get you heading in the right direction, but you need to do some of the work yourself. And there's an active framework that
Exactly
type of
right.
stuff. So I think you attract a certain type of person. If people want to go and get that more passive stuff, they'll probably just go and find it somewhere else.
They always do, right? Like
Yeah, yeah,
I have clients who see the physio down the road, and they will tell me they're like, oh, I go to him to get my back massaged.
yeah,
They come to me for the program.
yeah, which is fine. Yeah, happy days.
I'm not going to do it, right? So if that's what they want, it's still meeting their therapeutic
Yeah,
outcome, and therefore the decision making is in the patient's hands.
yeah, and you're happy to do it for a certain period of time, a small amount of the consult for say
100%.
5, 10, 15 minutes or something like
Yeah,
that, depending on
even
the
the
length of
first
the
year,
consult.
right?
But for the majority of the consult, that isn't going to be the focus.
No,
So, as we've discussed a million times, but it is a good point. And I think that people are getting to the point where they're not expecting us to be like a masseuse or something like that. Like people are going and getting massages elsewhere. And, you say that you're a physio at a party or whatever, and people aren't just saying, oh, you must give a good massage.
exactly
You know what I
right.
mean? Like that
Yeah.
always has that's always annoyed me. So yeah, we're heading in the right direction, which is good.
I
And the
think
uni
so.
students that you've had exposure to, because I've had a few uni students over the last couple of years come and spend a day or two with me. I don't take them on for a whole block of, um, say, a week or 2 or 3 or 4 weeks, like they have to, and they need to get their clinical placements up. But you have had clinical
Yeah,
placements?
we have.
Yeah.
We did like we've done we got three unis that we take students from,
Yeah.
varying in different ones. So we do one uni that's just a 5 hour observational for
Right.
their first year.
Yeah.
So they're coming into private practice, they're getting their eyes in there, they're seeing, but I tell you what, for first years, they're bloody fluid. And I'm talking about first year's masters or doctorate programs.
Yeah.
These kids are cluey kids for their first year.
Yeah.
Um, so the industry, I think from what I'm seeing from a student point of view, is it's definitely progressing in a really good way. But some of the feedback we are getting from these students is like, I went to this private practice, I'm still seeing interferential, I'm still seeing ultrasound. So it's still out there.
Yeah. Yeah.
Or, like a lot of physios who will, they'll say, oh, we just saw him, we were there over a 4 week period and we saw him do the same thing to every patient.
Yeah.
So obviously that's still evident in the practice. That'll never go. But I think as a whole, we're seeing less of that overall.
I think one thing as well, that some of the kids coming out maybe not getting enough of the hands-on treatment skills under their belt potentially. I think some of them have gone too far down the line of I'm not going to do any hands-on.
I agree with that.
And I think there's a sweet spot because you still want to be able to probably give some hands on here and there. And as we've discussed many times on this podcast, it's a small, small chunk of the consult, especially maybe the first one or two. It might be 5, 10, 15 minutes max. You still need to probably have those skills because people may feel better from it, but they may expect it. So I think that you don't want to just completely be a, this is black and white. You're either a massage passive modality person or you're an active modality person. It's not like that. We want to merge it, hence the name, the Hybrid Therapist Podcast. We want to be people that are merging both of them, but the focus is swayed towards the active.
We still have to, like, hands on equals trust, and
Yeah,
people
I
like
agree.
to be touched, right? So building trust also comes from hands on. And like you said, is it 5 minutes, is it 10 minutes? Look, even if it's 30 minutes in your first consult, fine. If that's developing trust, but then your overall plan is to get them active, that's still a great therapeutic outcome.
Yeah.
I think, touching back to maybe new grads or new physios, they do try and rush into exercise sometimes. And the reason why a patient may not come back or, may not rebook with them, and we see this with our young guys, is because they just pushed them into that and that wasn't what they wanted from the session.
Yeah.
And they go somewhere else for it. And maybe more of a senior physio would have been a little bit slower in that transition. Like
Yeah.
yourself, you would have done your hands on, developed the
Yeah.
trust, and then built the program with the goal of maybe even 6 weeks, whatever, to have them in a full program. I think that is, like you said, it's that rush or it's that too far to the exercise only
Yeah.
and they forget education.
Yeah, and it's not black and white, it's gray. There's so many things you can do in that initial consult. And I think combining some of the exercise, the education, tolerating strategies, and you can do the manual hands-on treatment as
Mhm.
well. And you can probably fit it all in if you want, but you don't want to do too much as well that you're you're time pressed. That's one.
Yep.
And the other thing is you can't solve everything in one consult. You need more touch points with that client most likely to get a better result. And you don't want to overwhelm them with too much as well.
How many times as a new grad, like think back to those years, Wildy, when you tried to cure them or fix them, session one, I'm going
Yeah.
to give you 10 exercises, here's
Yeah,
the
yeah.
plan, and never turns back up again. And now I look back at it and go, well, I just overwhelmed them. Like, yes,
100%.
my exercises were fine, my plan was great, but they've just gone like, what is he talking about? You
Yeah.
know, now that might take me 2 or 3 sessions to build out, but funnily enough, obviously the therapeutic outcomes are better now that obviously that's what experience is, right?
Yeah, yeah, for sure. Like we all
But
still make mistakes. It doesn't matter how long you've been doing what we've done, whether you're a doctor or a dentist or whoever we are, we're all still learning and making some mistakes. But
100%.
yes, I agree. I think that you don't want to you don't want to be black and white. And I think that look, Adam Meekins has done some amazing work in our industry, but I think he's maybe a little bit too black and white with the manual therapy side of things. And it's a little different as well. When you're in private practice, it's different than
100%.
working in public. Like
Yeah,
if you're in the public sector and you were employed as a musculoskeletal physio, you're employed to just do that job, you get paid
hmm
that, blah, blah, blah.
yep,
And there's a progression. But
hmm
in private, it's different.
way different. Yep,
It's completely different. Like there's the bottom
fresh
dollar. You need
demands.
to be
Yeah,
bringing in certain amount of clients. If you wanted to progress as a clinician, you want to be paid more, potentially go to the point where you're on commission or something like that. You're not over servicing, but what you're doing is you're just being smart about how many times you see that client and how you get the education, the exercise, everything delivered as a package over a period of X amount of
exactly
time.
right. Yeah, it is very different, right? And look, I always phrase it to a lot of young physios like politics. You've got your right wing, let's do it in American sense. You got your pro-Trumpers, and they're out there. They'll only ever believe in exercise. And then you've got your left wing. They'll only ever believe in soft tissue or whatever. Most of us are centralists. We
Yeah.
want to combine it all, and yes, we might sway more to this side, but you do want to have that nice center. And I think too far at uni sometimes we came out probably too far on this side,
Yeah, 100%.
and now they're coming out too far on this side. But bringing it into the middle, I think it was like Greg Lehman, who's very
Yes.
much a fence sitter, that you can't not agree with him because he looks at both sides of the argument and takes it into consideration.
He's very pragmatic, isn't he?
Yeah, I must admit, I started off a lot more when we started the podcast, we were a lot more right wing or exercise based. Even you listen back to it, and we were more on that side. I think now I've definitely come much more into I'd align much more with his beliefs now.
Yeah, I agree. I feel like I'm more of a hybrid that isn't so far down that exercise
Yeah,
path as much as I maybe was.
yeah.
So yeah, it's finding that sweet spot. Definitely.
That's right.
Mate,
So
we're back. We're back.
yeah, hey.
This is good.
So what's like?
Probably leave it there for today,
Yeah,
but let's just chat about what the plan is.
yeah. I think we're going to chat sort of once a month, aren't we?
Something
And
like that. Yeah.
I think, as well, we can also open it up to the listeners as what they want us to talk about. So I think next time, not next week, but next month, we're sort of going to talk about maybe some ACL research,
Yeah.
um, this bracing protocol that is, obviously very popular at the moment. So we'll touch on that, touch on maybe some positives out of it, maybe some negatives, what we're seeing in practice, which isn't always indicative of the industry, but what we've seen.
Yeah.
And talking from experience is an interesting point of view. Um, but I think for us, it's just going to be chatting maybe more about the elements of physio that maybe are the undiscussed moments.
Yeah. And at the moment, we're probably planning on not having guests. It's just us. So
Uh,
we're going back to season one to just us talking about certain topics and just carrying on.
and I think I had a few people when we posted that, we're back on, that subsequently hit me up or hit the business up about things. A lot of people want to talk about the business aspect. So I think both of us, maybe as business owners, can sort of maybe talk about and share some insights into that for people wanting to start their own clinic,
Yeah,
people doing it, because there's no support out there for
I
physio across
agree.
the business. So
Yeah, I agree. The pros, the cons, the frustrations, the highs, the
yeah,
lows, because
what we
fuck, it's not
see,
easy. It's not easy, and it's it's rewarding, but at the same time, it's definitely a harder route.
kind of like there's a reason why a lot of people don't open their own business,
Yeah.
right? Like I get it, but like from I don't think physios often call themselves entrepreneurs, but from an entrepreneurial standpoint, we're not known as an industry for that. So, I think touching on some of those topics will be,
I
it's
think that'd
good.
be worth even chatting about next
Mm,
podcast, or we
yeah,
may not touch the ACL one. We'll just figure something out, and then yeah, I agree. If any of the listeners have topics that you want us to discuss, happy to. And it's going to be a pretty casual format like this, where we're just conversational and go from there.
raw, uncut, and back to the old school.
Unedited.
Yep.
Just press record, press stop,
Yeah,
bang.
you'll hear all our mistakes, our fuck ups, things that we say wrong. We've got to own it, right?
Yeah, 100%. We need to be accountable.
100%. Might start throwing in some anatomy now, just in case.
Oh, geez, don't do that. Are we going to sign off with the where can you find us? Surely people know where to find us and
I
stuff, and
think
they
they
don't
know where
listen
to
to the
find.
end. They don't listen to
Nah,
the end anyway.
nah. They know where to find us. The only thing we sign off for is our catchy sign off tune.
Which was?
Stay hybrid.
Yeah, that's right. Geez, I've even forgot that we had a sign off.
I think we used to say stay hybrid, didn't they?
Oh, did we? I don't know.
I
We'll
don't
go
know.
with that. You can
Yeah,
stay hybrid, everyone.
yeah. We'll leave it
Right.
there.
We'll leave it there.